Beginning from February 2020, Nigeria's commercial center, Lagos, started to manage an epidemic, which soon turned out to be a pandemic after it recorded its first case of COVID-19. One case turned 2 to 3, and 1 year after, the state, which is now regarded as the epicenter of the disease, is now accounting for a total of 22,562 cases, where over 21,000 persons are said to have recovered from the pandemic, with about 220 deaths recorded. Following the impact of COVID-19 pandemic, Lagos State reduced its expectation for the year 2020 from a proposed budget of 1.169 trillion naira. The state reviewed it downwards by 21% to 920.5 billion naira, out of which it was still able to attain an overall performance of 86%. Towards the third quarter of the year 2020, a state which is already grappling with the effect of COVID-19 pandemic on its economy, which was under lockdown for months, experienced another outbreak of a protest against police brutality in the country. The protest act, Ash Ensas protest, was soon hijacked by hoodlums, leading to the destruction of public and private properties, looting of small businesses who were still trying to recover from the lockdown. With the aforementioned, having the 2021 budget themed rekindled hope and many proclamations of the theme's agenda is indeed remarkable. The 2021 budget of 1.163 trillion naira seeks to prioritize the completion of all ongoing projects in the state and then meet a series of objectives from employment creation, increasing investments in human capital development, very important, education, and of course, healthcare. Deployment of functional technology in public services, amongst others. Now, a breakdown of the budget shows a capital expenditure of 702.935 billion naira, recurrent expenditure of 460.587 billion naira, with an estimated revenue of 971.028 billion naira. The budget has a dedicated 20 billion naira for COVID-19 funds budgeted and a total of 106.088 billion for the health sector. Well, according to our research, this is like 9% higher than that of 2020 budget. The strategic focus of the health sector budget includes completion and equipping of new Mercy Children Hospital, General Hospital in Ojo, upgrading of the e-health platform, a lot and a lot. We can go on and on. Construction of an oncology center in Bagada, construction of infectious disease center in Yaba, and the rehabilitation and upgrading of the General Hospital, Lagos Island. Well, let's stop the analysis there. I have the right persons with me in the studio to break it down further and analyze the government spending plan with focus on the health sector, allocation, and how it plans to deal with the second wave of COVID-19 and all that has to do with this document. I have first the Lagos Commissioner for Economic Planning and Budget, Mr. Sam Egube. Thank you very much for your time.
Thank you, Tolu.
It's great to have you on the show.
Us, yeah.
And of course, I also have here the Commissioner of Health, Professor Akin Abayome. It's a pleasure really having you on the show.
Pleasure.
Thank you so much. Let me start from you. We've seen an increase, like I identified in the intro to this. With all of the challenges we faced in 2020, let's do a brief overview. How would you rate the performance of that spending plan?
Well, the spending plan turned out exceptional. We closed the year eventually with a performance of 88%, right? Our CapEx performance was at 89% in terms of how we executed on the capital expenditure, which goes to show the effectiveness of our monitoring capability and our execution capacity. And it's in the light of that, when we then look at how we intended to prosecute the 2021 budget, it was going to, even though you see an increase of 9% in the budget size, what you will see in that increase is a more efficiently run budget. Because you will see that in the health sector, apart from capital spend, one other important aspect of it is the human resource spend, because it's a service industry like in education, in the education sector. And so you will see that a combination of the spend for the welfare of the medical personnel and our capital expenditure actually moved from 64 to about 74 to about 70% of the total spend. And that increase is coming out from what we'll be doing in the welfare of our people, right, in that sector, and also in the capital expenditure. You will notice that the overhead spend will have gone down. It means that we're going to deliver more with less overhead spend, which is a more efficiently run scenario. Medical personnel will be happier, better cared for. Our capital expenditure will pace itself very nicely, both in projects that are ongoing, that we're rolling over, like the Mercy Children's Hospital and so on and so forth. And there are new projects also that are going to be delivered, which is supposed to improve the general health infrastructure across the state, and also to create a mechanism and a platform under our health insurance scheme for the people to also be able to access. So you will see some commitments around the health insurance scheme, and then you see a lot around infrastructure. And of course, the Honorable Commissioner for Health is here, who will throw more light as to the techniques and the strategy around how he intends to deploy this year to just make the health sector rise.
Yes, yes, indeed. Professor Abayomi, a pleasure again having you, because we've seen you. We always see you every time when it comes to issues around COVID-19 and what you've been doing. I know Nigerians and Lagosians, they've all been commending you, and we keep commending you. But 106 billion, that's what we have for this year. Let's take us through first how our health system, talking about Lagos, where are we and where are we going to be as we move on with the themes agenda?
So I think where we're trying to get to is a health system's resilience. So you can see that with something like COVID, a shock comes unexpectedly. Now, we learned our lesson from Ebola, that Ebola can pop out of nowhere and it can take you by surprise, and we call it a pathogen of high consequence. In other words, when a pathogen like that enters the community, the consequences are high, not just for the health and well-being of the patients or citizens of Lagos, but also it has the ability to stop your economy. So you can see now that health is actually an economic issue, and we've experienced that during COVID. So COVID came and threatened to shut down Lagos state economy, as well as the country, and you can see that multiple economies around the world have been put on standstill. So we have learned our lesson. We built a resilience into the system from Ebola. We took off from that, and we were able to launch a fairly strong attack against the COVID onslaught. We managed wave 1, but the whole world is going through wave 2, wave 3, and even wave 4. But we're in our second wave at the moment, and we're handling it with a lot of experience gained from the first wave, and all that infrastructure that's been put together, the preparedness, the launching of the incident command system with Mr. Governor in charge to make sure that things move very quickly. So it's a fast-track system that allows us to deploy very quickly, to make policy decisions very quickly. But what we're learning from COVID is that, we are moving into an era of biological shocks because of the global shift in population densities and environmental toxicity. So we must be prepared for these kinds of events periodically.
Yes.
And it's not, okay to be reactive. You have to be proactive. And to be proactive, you have to set up a system that is resilient, a system that can pick things up quickly, have personnel that are trained, have resources, have infrastructure. And when we talk about infrastructure, and one of the biggest things that Mr. Governor is dealing with now is what we call the Lagos State Blueprint for medical infrastructure transformation. So what has characterized our infrastructure to date is, random acquisition of buildings and conversion to medical facilities. And we're trying to change that paradigm completely to purposely designed fit-for-purpose infrastructure through this blueprint across the board, from primary healthcare to secondary to specialist facilities, so that we have a blueprint design that we can just keep deploying into the field wherever we need it. We just adapt it to that environment. But it's been designed by experts from across the world. You know, we're dealing with international benchmarking here.
Great.
So that, you know, in Lagos, the future, you will easily recognize a health facility in the next few years. They will have a distinct look, a distinct feel, and it's one of the features that we're trying to develop to ensure that our medical personnel want to stay at home inside these well-designed, fit-for-purpose infrastructures.
Well, we are still going to talk more about the upgrading and renovation that will be going on in 2021. But let me quickly ask Mr. Igube, looking at this 146 education, 167 infrastructure, and 106 for health, like I said earlier, it seems like this is almost like a third of the whole budget. Why is Lagos focusing so much on this at this time when we're looking at economic recovery?
Okay, so in every society, right, your human capital is really the asset. So when we talk about oil, we talk about solid minerals, and you say, okay, Nigeria is still not progressing as much as we can, the secret is in the human resources. And in that human resource, you'll be looking at education, you'll be looking at health. If the people are well educated but unhealthy, then their productivity will drop, because it's all about the productivity of the people. Your population is not a strength if the population is not productive. And that is why it's important that we put our monies in the places where we believe, right, that if that capacity is ignited properly, then they can then manage the entire resource available to the state for outcomes that put the state where the state wants to be a model mega city in Africa and a global financial and economic hub. Now, to do that, you want to be able to raise your capacity to earn, and you want to be able to shrink, or improve significantly on your efficiency as the way things are running. Now, one thing that the entire lockdown has done, it has pushed very heightenedly, right, our need to deploy efficiency using technology. So you will see in the budget also that the technology spend is increased dramatically. And it's on top of that platform, we are riding our broadband infrastructure. Right, our broadband infrastructure is a 3,000-kilometer broadband ring around Lagos. On top of that, we are putting on a smart city initiative for security, because if the people are healthy and educated but feel unsafe, then they will still be unproductive. Right, so we'll drive that infrastructure with 2,000 cameras, intelligent cameras around Lagos, right, that would have facial recognition, number plate recognition, to be able to control all of this to a command center. Now, health will then ride on top of that also, because there's a challenge as you begin to develop your health capacity in terms of the medical staff and in terms of the infrastructure. We then need to implement technology on top of that. In other words, digitize the entire record so that we can share information reasonably and lawfully, right, so that the patients can get service, but also to be able to reach out to patients to our Lagos telemedicine framework. Right? That creates a lot of efficiency, because more people can serve using technology. You can access information quicker, faster. You can take decisions quicker, and it is less laborious for our medical personnel and helps them to improve their productivity. So it's important as a strategy of state that we focus very intensely on our people. Right, and focus also that the vulnerable is not left behind. True. So when we introduced the insurance scheme, the idea around the insurance scheme is that a lot of people can access health service. And it's not expensive, with probably about 40,000, right? You can take care of yourself, your wife, and 4 children. Wow. That comes to roughly about 500 and something naira in a month per person. And as an individual, about 700 or so. So we are encouraging people to do that so that they can access all of this infrastructure, which the Commissioner for Health has talked about, will be sprawling around Lagos. Yes. So they can access it, and the facilities will become there. So we must make that investment, and I think that's what we've done. So you saw it in education, you saw it in health, yes, right? Then you saw it in infrastructure. But what I always say to people is that all of those things, they are a web of interventions. So what you see in infrastructure, you might see a road that makes it easy for you to get to a healthcare facility, right? When you see education, for example, that education helps to ensure that we're able to produce the human resource that we stand in and hold and provide services in that sector. When you see technology, right, it may not sound like health, but the basic infrastructure around which you are digitizing medical records and upon which you are doing telemedicine, and the Commissioner for Health will tell you that even when it comes to contact tracing and all that, to be efficient, he had deployed a lot of technology. So the entire budget actually comes together very nicely to produce the kind of outcomes that the people of Lagos will be very proud of.
Prof, impact, very important here. Impact. Now, Lagosians need to feel this torch, and the health sector is key when it comes to this. Completion and equipping of new Mercy, I identified that during my introduction, and also the oncology center in Bagada. I don't know if you would like to take us through all of this so that Lagosians will understand what they really stand to benefit.
Okay, so there's a hierarchy of medical infrastructure.
Okay.
So you start at the base with what we call the primary healthcare level. And we have just over 300 primary healthcare facilities across the local government areas of Lagos. And then the next layer is what we call the secondary facilities. And they are general hospitals, although we do have some monospecialist facilities. So a general hospital will see pregnant women, children, surgery, medicine, eyes, ears, every accident and emergency. But a monospecialist hospital would be like a pediatric hospital or a infectious disease hospital like we have at Yaba. And we're trying to deploy more specialist facilities as we move year by year.
So this is what will be.
So this is the Infectious Disease Research Center. The one before that was an isolation center. This is the outside of the Infectious Disease Research Institute.
Wow.
This is the blueprint for the General Hospital and the Children's Hospital. So that's the new Massey Street Hospital that's being built on Adeniji now. And this is what our primary healthcare facilities will look like.
Wow.
So this is a new blueprint. And you can see it takes into account eco-friendly, lots of air, ventilation, and it can be easily converted into an isolation facility if we have another epidemic. So a lot of intelligence is going into the blueprint. It's going to be a low carbon footprint. It's going to be naturally ventilated. It's going to use natural materials. The patient flow and the staff flow is all designed for maximal efficiencies. And so this is what is going to happen in terms of infrastructure moving forward in Lagos. And slowly you will see that transformation happening. Then at the top of the apex of the health structure is LASUTH, which is our Lagos State University Teaching Hospital, which is where we train doctors and we do a lot of research. Whereas in the secondary and in the primary, we do the bread and butter of medicine for residents of Lagos.
So what should we expect in regards to LASUTH? What's the big thing happening with LASUTH?
So LASUTH itself is going through a transformation agenda. The board and the chief medical director, as well as myself and Mr. Governor, are talking about how to transform LASUTH as the apex medical facility of the state to be one of the foremost tertiary academic centers in Africa, as it should rightfully be.
Now, I'm going to ask you this, because when we talk about all of these beautiful pictures we see, we're talking about spending a lot of money, and money needs to come from somewhere. We are looking at debt service ratio going to rise from like 19 to about 22% in 2021. Now, how do you see this? Do you think it will affect intergenerational fiscal stability?
Okay, when you talk about that sustainability benchmark, so the first thing I'd like to assuage you, don't be scared of loans.
Wow.
Right? Be scared of your inability to manage your loan book. This team, right, is led by Mr. Governor, Babajide Olusola, and that is his area. He has a history in structured finance and corporate finance. I too have that experience, and we have a team, the Commissioner for Finance, and everybody. We have a very strong cabinet. Now, at 22, we are well within the sustainability benchmark by any chance. I mean, if you look at some of these benchmarks, say 40%, some others say 30%, but we are 22. And we're using bespoke methods, right, to make the capex of the state come through. I mean, at this time, we've announced that the red line is flagged off, right? That is a huge investment, and I don't know of any subnational that is undertaking such a project, but we're about to flag off again the blue line. Right, and all of these projects will go on to completion without putting significant burden on the balance sheet of the state. That is because the talent that is required in cabinet to produce this kind of structures and the relationships required to pull them through are present. Right, which is why we like to assure Lagosians and everyone that is listening that we have our hands on the ball, right, and the structures are within sustainability all the time. And there are all our PPP transactions that will stream out. A lot of the projects which the Honorable Commissioner of Health had talked about, we're going to be pulling partnerships in, right, to also drive the support. So we will have more from less of our balance sheet, right? And it's the nature of it. But beyond that, right, we're also looking at our revenues. We believe, right, that there are huge opportunities to increase significantly our revenue base, right, in terms of the way we'll drive with our partners on the granting and capital receipt side, and also in the way we'll drive in the taxation side and all the issues around our revenues, right? And if you see, we have a very strong monitoring and management mechanism to ensure that we look at all of this to make it work. So we are deploying technology through our central billing system, that everybody in Lagos has one bill, and it is not, we remove the discretion, right? Beyond that, we're looking at other lines where we perceive that we could do more than we are doing, and then build structures in it. I think the objective really is to simplify the collection process, to be able to automate it in a manner that we're able to get more. It's not going to be heavily people dependent, but systems dependent. You know, we talk about institutions. We're strengthening our institutions to ensure that these things move efficiently, smoothly, and the people of Lagos will see the service and therefore will be encouraged, right, to participate. Because we're all stakeholders, not stakeholders only by being resident in Lagos, but stakeholders because we also pay our taxes and our levies. But not only that, we encourage our neighbors to do the same. And that's how we believe that we shall see another inflection point in the way we take up our revenues in Lagos to meet the challenges, the infrastructural challenges that Lagos actually demands of us to do. With 22 million people and growing, with a lot of people coming into Lagos from other cities and other states in the nation and across the continent, it's important that Lagos rises up infrastructure-wise and human capacity-wise to deal with those challenges.
Let's talk about rebuilding Lagos. It's key, talking about rebuilding Lagos from what has happened. I think there's a plan for that also in the spending plan. Can we talk a little bit? Can you take us through that?
Okay, rebuilding Lagos is part of the original agenda.
Okay.
Right? What the NSAS destruction did was to just heighten our attention on that plan. It was always going to take us to a greater Lagos anyway, right? And so we are going to build better. We are going to build smarter buildings. The Commissioner for Health, in talking about all that he's doing in the health sector, you keep hearing the things about smarter buildings, better fit for purpose facilities that are environmentally friendly, because this is a mega city and it must compare, as our vision says, with other leading cities around the world and should be a leading city in Africa, a model city in Africa. So I would say that, yes, the work for the Rebuild Lagos is on. There is a trust fund that has been set up by Mr. Governor, and if you see the membership of that trust fund, it's made up of extremely experienced people with a lot of capacity and integrity to drive. The private sector is being pulled in to support that effort, and Lagos State as government also will contribute very immensely to that effort. So you will see, for example, that a lot of these traffic lights that have been destroyed are being brought back on stream. You could see the chaos that took place just after the aftermath because of the absence of control of the traffic. Now that is coming back to normal. We are looking at, there are people and entities that are saying they want to participate in contributing to this build. Now, we believe that will happen because that had shown very clearly during the COVID. Lagosians stood up, private sector stood up, worked together with government, either together or even standing alone to intervene in the environment. That is really how we have pulled through so far. Now, so it's important that the spirit of Lagos is sustained, that partnership, that camaraderie, that looking out for one another is sustained, and that is what Mr. Governor focuses on doing. So you see a lot of private sector engagement, there are stakeholders, you see a lot of community engagement, a lot of engagement with the traditional rulers, a lot of engagement with the youths. You will see the way this budget is being structured. There's an increase, a dramatic increase of about, I think, 50-something percent as to what we want to do in the youth sector, both in engagement, reorientation, and in trying to bring them together through sporting activities and entertainment activities to basically just build that resilience that help us build our state up. It's just the way we're organized. So it's clear in the budget there's a 15 billion provision, right, that would support the work, right, that is being done towards rebuilding all of those assets in Lagos. We are confident that even though we cannot alone do it all, we are confident that Lagos will rise again and join forces with the government, right, to do well. And you find out that when people see that a government is organized and is implementing properly, there is support that comes because of that faith, even from the federal government. So we expect the federal government, community leaders, business leaders, both at home and abroad, to support the building process. And from the inquiries we're getting so far, we believe we'll have a good outing.
All right, I'm going to talk to Prof, but let's take this break, and we'll be back in just 1 minute. Don't worry, Prof is here, and Mr. Gupe is here. We'll continue the discussion around Lagos budget. It's your business, Nigeria. Don't go away. We're glad to have you back. We're still talking Lagos 2021 budget. And I have in the studio the Commissioner for Economic Planning and Budget, Mr. Sami Gube, and also Professor Akin Abayomi is also here to speak on all of this and how it has to do with the health sector, which is key at this time. Now, Prof, before we went on that break, I was looking at those beautiful pictures on television. What we expect, yes, we know that Lagos is always the center of excellence as it is. But the personnel that will handle all of this, how well are we going to equip them? And the Commissioner talked a lot about technology. How are we also taking advantage of that to actualize all of this?
So for the personnel, you know, we always talk about the brain drain effect in Nigeria. So, of course, Lagos would suffer from brain drain. Doctors move to Lagos, and then from Lagos, they move out of the country. So, you know, when there's a drain on human resources, there's usually a pull factor and a push factor. So the pull factor is usually the attraction to going to Northern Hemisphere or to the Americas. But it becomes worse if the push factor is added to the pull factor. So what we're trying to do in Lagos is to eliminate the push factor. In other words, create a working environment that's conducive for our health personnel, give them technology, give them equipment, train them better, give them access to learning opportunities, allow them to specialize, you know, under the right circumstances. And you know what it's like to work in an environment. If the building is not conducive, it becomes a hostile environment to you. Sure. If your staff are not, if your patients and your clients are not happy because they're sitting in crowded rooms, or it's hot, or it's not well ventilated, or there's no light and there's no water, you know, these are some of the elements that make the job less enjoyable, and they're more inclined to be attracted to work abroad. So we're trying to create the same environment that they would find in Europe or in America. Exactly. Nice buildings, well-equipped, public-private partnerships that make things efficient. We're about to digitalize the whole of the health sector. Wow. We heard about the infrastructure that's being laid down across Lagos. We need to wait for that because that forms the connectivity. So if you see all those colored pipes that are being, the fiber optics that are being laid across Lagos, that's the ring of connectivity. And the hospitals just need to tap in to all these high fiber internet. And once that's laid, then we can connect all the hospitals, and we can build what we call the Lagos State Smart Health Information Platform, which means that all the hospitals, including the primary facilities, the secondary and the tertiary, will all be inside one network. If I want to refer a patient from primary to secondary to tertiary, it just goes automatically without paperwork. It's seamless, it's fast. It also helps us to get more health for our money, for our budget. Because when you digitalize things, you eliminate wastage and you plug leaks and areas where we are losing resources because of lack of efficiencies. So, it'd be nice for our doctors to be working on a laptop, to be able to just type in the patient's data, move it from one place to another, pull for laboratory tests, pull for radiological tests. It just makes your working environment more comfortable. You feel more satisfied. You're less like, how many Nigerians actually want to leave Nigeria? Most people are from here. They want to stay here. They only go abroad to either get something and come back. Yeah. But if you go there and you find that the place is just so much better than where you came from, then you're not likely to come back. So we want them to remember, oh, the building I was working in was well designed, it was nice, it was breezy, it was cool, it was efficient, I was working on laptops, I had a digital platform to work with. Then, they can go and advance themselves in whatever area of discipline they want to, but they'll always come back home. So that's the idea.
That's really a good one. It's going to be encouraging for you to want to work in the health facilities. Now, like I always say, whenever Prof is painting all of these beautiful images, I come back again to finance, which is key. Because yes, I know Prof is ready to make all of this happen, but the money also has to be made available. Now, we're looking at a deficit financing of 192 billion and about some internally from bonds and externally. Can you take us through how you will make this happen?
So basically, it will be funded in broadly 3 ways on the balance sheet. We'll do about 100 billion in bonds. We'll do about 37 billion in normal internal loans from banks. And we'll do around 54 billion from multilateral agencies internationally. Right, those are high concessionary loans, right? Very long, longly stretched, comfortable for us to manage the debt service in such a way that our sustainability framework remains intact. But like I said some other time when I was asked the question to say, look, what's the uniqueness of this budget, right? As part of our strategy, right? One of the things that we always watch out for is our ability to do more with less. In other words, when you see a budget of 1.164, we want to be able to deliver for the state in that time much more than 1.164 can deliver in the kind of partnerships that we attract into the mix, right? So when you see the red line driving, when I talk about the broadband, which is a very significant strategic investment for us, that doesn't pinch any scratch off my budget, even though it will create value on top of my budget that Lagosians will be happy for. It will create productivity amongst our people because they are able to do much more, much faster than they will have done in the past. And when I say our sustainability is 22%, it is factoring in, right, all of this. And it's a very, very, very conservative budget that we have shown. If you see what we have projected under our federal transfers, we have kept it basically static at 175 billion.
Yeah, I think that's conservative enough.
That is conservative, right? And we expect to do much better than that in the way we drive. But even at that, we do not just borrow perfunctorily, right? We borrow intelligently. So you will see that everything we achieved, right, we only probably drew about 40% of our deficit position in the 2020 budget. Okay. So we are driving very advisedly, right, as we approach. But irrespective of how we drive and where we land, right, along the plan that we have, yes, it will be a sustainable borrowing. So people shouldn't always look at the amount you are borrowing, the amount of debt service that a person who takes 100 billion and has to service 5 billion every month is different from a person who takes 100 billion and needs to service 1 billion every month.
Every month. There's a difference.
It's a big difference.
Prof, let's talk about health insurance. That's also very important on this time. I know Lagosians would like to know what's happening with regards to that. How well are we getting on with that?
So one point I want to make here is that, I mean, you keep talking about these very elaborate plans in health, and that, you know, my commissioner needs to now go out and find the money.
No, I think...
So it's also important for you to know, and for Lagosians to know, that, the health sector is also trying to become more efficient and become more neutral, so less draining on the budget. So when we become a more efficient system, we'll be pulling down less on the budget, or whatever they give us from the budget, you know, whatever we're able to beg, scramble, and beg for. You know, we use that more efficiently, we get more health for our money, and, you know, we can stretch it out a little bit more, you know. So health is looking to become a neutral agency within the government, whereby we're not just this social service that continues to pull like a parasite on the budget. You know, we want to actually contribute to IGR. We want to contribute, and we're also trying to create an enabling environment for the private sector to flourish as well, thereby building the opportunities for these private partnerships to engage each other, which makes life much easier for us.
True.
You know, government is supposed to be a public protector and a regulator and an enabler of the economy. So it's not for government to build all the systems within the government, but it's within the society. It's for government to create that opportunity. So there comes in the insurance, because you know, health is expensive, you know, and what we have now is about 20 to 30% of Lagosians use the public facilities, which are heavily subsidized. I mean, what you get for your money in a public service is you know, a fraction of what you would get in the private sector because of the disparities between tariffs. And then the remaining 70% of Lagosians go to the private sector, and most of them pay for their health out of pocket. And those that are purchasing health through insurance are less than 1%. So what we're trying to do in Lagos is to build the Lagos State Health Insurance Scheme, where everybody makes a contribution, and then you get a bouquet of health services as a result of it. So it's almost like a bank. Everybody is paying into the bank, but not everybody is using what they're paying into the bank. So we can now use that to build the health infrastructure, because it works on a capitation basis. So the number of people that are registered on the health insurance system per facility, that facility gets what we call a capitation every month, which takes care of the potential for those numbers of people to present to that facility. Now, if they don't present to that facility, then that facility uses that capitation to better itself. And it's a competitive environment as well, because you're looking for patronage. So the better your facility is, the more patronage you get, the more capitation you get. So there's something built into that protects government, protects the community, engenders competition, and the standard starts to rise. And then we stop draining the government, because the society is actually paying for their health and buying their health.
True.
What it actually does, again, is that it improves that capacity. I mean, you can tell how our testing capacity has multiplied.
I was going to ask you, to be a disincentive for him not to talk about COVID-19. I don't know, Lagosians and Nigerians won't be happy.
But I'll tell you also, I mean, I was talking with one of my staff recently who wanted to make an investment in land. And I asked him a few months after, have you made the investment? He says, no. I said, what happened? His wife put to bed. And he had to spend about 250. I said, what of your insurance? He said he doesn't know much about that he knows I've been saying, but he doesn't understand how it works. And I said, well, with 40,000, you will not have paid the 250. He said, how do you spend 40,000 for 250 costs? I said, that's what insurance does, because it pulls together the people on the assumption that everybody will not fall sick at the same time. Exactly. And, you know, we teach our children that there's love in sharing. Insurance means let's share the burden together as a people. So if he had insurance, he would have at least had 210,000 left to make his land investment. But he's now had to spend it. So we encourage everybody, and it's part of the communication and the structure, that people participate in the health insurance scheme. It's inexpensive for what it carries, right? But it creates an enormous economic value to the individuals and to the state in general. Because if the businesses and the people of the states are doing well, then the state is doing well.
I see there's going to be a lot of engagement. You said that, and I want you to just talk a little on that, of youth and social development at this time, because that's also very key. This sort of Soke generation, they all want to hear from you. What more should they expect from
By
this?
the way, I'm part of that generation. Don't talk to me as if I'm not.
I'm part of it.
Anyway, the truth is that there's a generation of people coming up.
Okay.
And the good thing about these people is that they speak up. And that speaking up is good for governance. Because one of the idea of the Babajide Olushola's administration is that when Lagos speaks, we listen. In which case, when you see the budget the way you see it, one other unique thing about the budget is how many people participated. We had consultative fora around to pick the mind of the people, because we believe you love someone the way the person wants to be loved, not the way you think the person should be loved. So we have a huge population of youths that must be engaged. And they are challenged on every side. They are challenged in education, they are challenged in healthcare, they are challenged. So when we talk about the insurance scheme, we are looking at them as well. They need to be healthy. When we talk about what we are doing in education in terms of deploying technology there, where we talk of the infrastructure we are putting there, it is also to support that particular group of people. When we talk about the heightened investment in technology, who are the guys driving technology? They are pretty young people, right? And they get engaged. And lastly, that generation thrives a lot from interaction. And so sports has become another unifying factor for that sector. So we'll be supporting sports in a heightened manner. We are driving a creative arts academy, which is another sector that attracts a lot of our youth. Right? When we pull all of this together, right, you will then begin to see that the people in that segment begins to get better. But we recognize that it's not just about what you do in terms of infrastructure. You also need to reorient our minds, because there's a particular way of thinking that prevents even all these things we are doing from producing results in the lives of our people, our children, right? So we need to begin to reorient them, and we are making investments in that engagement, right? We also, the budget is organized for job creation. So when you see the investment in infrastructure, the whole idea is to create good jobs now, but also to prepare the efficiency of the MSMEs for the future, because they also are a behemoth in terms of creating jobs for our people. So if it becomes cheaper to do business in Lagos, then they are able to do more and employ more. We're also trying to address our mechanism for assuring the ease of doing business in Lagos, to just ensure things get better. So we're digitizing the land allocation system, the land acquisition systems. We're trying to organize the real estate sector through our La Serera initiative, the agency, right, to ensure that there's enough transparency for people to participate. And now all of this basically speaks to the youth, because really this is a world we're creating for them, and tomorrow really belongs to them.
Now, let me quickly ask Prof. It's a month and 3 days into 2021, and we see the figures. We'd like to hear from you. I don't go to parties anymore. I'm always in. I come to the office and I go home. I try to maintain social distancing. But take us through what's been happening.
So, the whole COVID game is a game of anticipation. It's not a game, it's actually a war. But in war, you have to anticipate all the time, or you get caught flat-footed. So we anticipated COVID was coming, and we prepared. We went through the first wave, and we calmed down, and we anticipated that there was going to be a second wave, because we're watching the global landscape, and we also know how pandemics behave. So we anticipated it. Now it seemed to coincide with the festive season and the opening up of the economy. And one of the things we do as government is to balance the act between public health response and sustaining the economy. If you have sick people, you make them better, but you certainly don't want your economy to be sick. So as that's why we're a government. So health works with economy, works with finance. We work together to say, okay, this is what you have to do to keep the environment ticking over and rolling over. If we go through another lockdown, we know what happens in lockdowns, the economy goes flat, and we generate a state of insecurity. So it's a tripod: health, economy, and security. And that's what we do in cabinet, under our leadership of our governor, to ensure that, we're finding that nice balance across the sector. So we're in the second wave now. It seems to be, we have our systems in place.
Wow.
We're matching the demand of oxygen with supply. Wow. We're making our own oxygen. We're opening up new centers. We're retraining. But we learned a lot from the first wave. So even though the second wave is slightly larger than the first wave, we're able to handle it better than the first wave because we're learning more and more about COVID as we go along.
That's a good one. Now, I want to hear from you, a parting shot from you, because I know you have a lot to still tell us, but let's just wrap it up. What more are we expecting in 2021?
I would rather not talk more about what more, because we've said quite a lot for people to consume.
A lot.
I'd rather talk about what I want Lagosians to do in 2021.
Okay, great.
I would like Lagosians to generally improve the health situation in Lagos by subscribing very actively to the Lagos State Health Insurance Scheme. Health issues can easily pauperize anyone when it comes on you. It can take away your confidence, take away your investment, take away your savings. And we do really encourage them. We encourage employers to take it on for their staff. We encourage families. Because really, when someone is sick and he can't help himself, the family must together or the employer must come together. Why don't we allow the system to take over at that point by really participating very aggressively and meaningfully in the health insurance scheme? That way, we will grow a healthy environment. We will be able to build healthy systems better and easier. Health workers will be better compensated. We're able to set better standards for those who will participate in the scheme, right? And then you will say that the economy is getting better because people have more time to work and to be productive than to be in hospitals.
All right, there. Any word from you? 1 minute, Prof.
Well, I mean, this is absolutely correct. We've been pushing the health insurance scheme, but we just want to encourage Lagosians that, the government is anticipating events all the time. We may go through the second wave, go through a third wave, but we have constant information going out to the people of Lagos. We want them to listen to us. We want them to trust us. We have everybody's interest at heart. We are looking both immediate, intermediate, and long term. So it's a grand master plan, and you will see over time how things unravel.
Commissioner for Health, Professor Akiabayo, may I thank you very much for your time, and I must also thank you, Commissioner for Economic Planning and Budget, Mr. Samegube. Thank you very much for spending the afternoon with us on Business Nigeria.
It's been a pleasure.
All right.